broadcasting out of NissanCommunications.com with our producer Amnon, who's been working the logistics of today's program. And I have a special guest, Dr. Edward Kondrot from Dade City, Florida. And we're going to give him an introduction. I would like to do a quick prayer, and it came into my inbox this morning. It's the concept that this is a community. What one is lacking, the other fills in, so that together we make a perfect whole. And this is what is needed to make a healthy community, that each of us recognize that we are lacking and that we need the other to make us whole. And I think that was just so beautiful to me when I read it that I wanted to share it with all of you. And now we also have our co-host, Dr. Deepak Sharma, calling in on audio from the Orbits Clinic in New Delhi. And so welcome to Dr. Sharma. And
Hello.
Good day. Good evening to you. And Dr. Kondrot's, yes, Dr. Kondrot's best-selling books. Ooh, you're going to see it's invisible because we got a green screen, a blue screen, so you can't really see it. Okay, here you go. Dr. Kondrot's two best-selling books, Healing the Eye the Natural Way and Microcurrent Stimulation, Miracle Eye Cure, share all of his knowledge. So those are some books that you really want to have on your shelf or in your bed reading them. Both books are solid introductions into his philosophy and practice, which is completely holistic. His latest book is The 10 Essentials to Save Your Sight and has received rave reviews. He's the president of the Arizona Homeopathic and Integrative Medical Association, clinic director of Integrative Medicine of the American Medical College of Homeopathy, host of Healthy Vision Talk Radio, director of the Florida Wellness Center in Dade City, Florida. And maybe some of those, I don't know if you actively, the presidents of those associations at this time. He's going to give you lots of information, webinars and other things that you can participate in. So hang on to your hats, and we're going to go really fast in today's program with like 100 slides. So here we go. Welcome.
Yeah, hello, everyone.
Yay.
It's a real pleasure to be here, and thanks for that wonderful introduction. And one thing I really enjoy about homeopathy is that every time I treat a patient, I'm treating part of myself and, you know, the spiritual essence of helping someone. So I'm going to go through a lot of material, and I want to make this entire presentation available for you. So just email me at info@healingtheeye.com, and I'll send you a copy of the slides. So I guess let's begin, Debbie.
Yes. Okay, we're ready. So the slides are going to come up, and we have the introduction, September 1. This is the Health-Inn show, and you have his contact information on the first slide, and then we're going to see a photograph of this wonderful, incredible
Yeah, this is my
place.
wellness center in Dade City, Florida, and this is a center where folks come and stay for a couple of days, a week, to receive treatment to help them with their chronic eye problem. Next slide, please. It's a fully functional ranch, which is a lot of fun. Up in the right-hand corner, I'm on my John Deere tractor, but we have goats, pigs, chickens, an organic garden. So we're fully sustainable in an organic environment, which is a very healing community for people that come. Next slide. My wife and I, we just finished the Camino de Santiago Compostilla, which is a sacred pilgrimage in north of Spain, and we did this to raise awareness for macular degeneration. It's a 500-mile pilgrimage, and we appreciate all the people that supported us. Next slide. Now this is tied in because Martin Sheen did a movie called The Way, and it's all about the Camino de Santiago. If you're interested in learning more about the Camino, pick up a copy of The Way, and there's our website. We kept a daily blog on the Camino. Next slide. And Martin Sheen, we have a connection because he did a special production on the Florida Wellness Center. And I'd like to show his video production of our center so you know a little bit more about me. So I wonder if we could play that video.
The eye has been called the window to the soul. Now, some in the medical community are discovering it may be a window into health and nutrition as well. Eye disease is one of the most common causes of permanent disability in the United States. More than 20 million Americans age 40 and older have cataracts, and 10 million Americans age 60 and older have age-related macular degeneration, or AMD. These eye diseases occur as we grow older, and proper nutrition may have some effect on both of them.
In my 35 years of practicing ophthalmology, I am convinced that eye disease is caused by three important items: poor nutrition, the accumulation of toxins in the body, and stress.
Several green leafy vegetables such as spinach and kale contain the most antioxidants, which protect your eyes by reducing damage related to oxidizing agents that can cause age-related eye diseases. However, the vast majority of the American diet is extremely harmful to our eyes, and experts caution against eating foods that over time can cause serious eye conditions.
The traditional American diet, consisting of genetically modified food, preservatives, and high fructose corn syrup, is destroying our health and vision.
Dr. Edward Kondrot is the world's leading homeopathic ophthalmologist who devotes his practice to traditional and alternative therapies for the treatment of eye disease. His prestigious Center for Healing the Eye, located in Dade City, Florida, just outside Tampa, promotes wellness of sight, body, mind, and spirit.
My belief is that the body can heal itself, and my goal is to restore lost vision. We use therapies like microcurrent stimulation, syntonic light therapy, oxidative treatments, homeopathy. All of these are non-surgical treatments that not only help treat the underlying cause of disease, but they also act as a catalyst to help the body heal itself and restore vision.
The center treats patients who seek holistic, non-invasive therapies for eye problems that include macular degeneration, glaucoma, cataracts, eye strain, and other eye disorders. Dr. Kondrot has a worldwide following because of these successful therapies. Well-known author and psychologist Dr. Basha Kaplan came to Dr. Kondrot for treatment of glaucoma.
For 10 years, I had taken glaucoma drops. I was diagnosed with glaucoma. I had emergency cataract surgery in both eyes, and then I developed epiretinal membrane, where within 1 month my vision went from 20/30 to 20/50, and I didn't know what to do. I was just freaked out, and Dr. Kondrot gave me back my life after I went to his clinic.
When we went to Dr. Kondrot, he did established a whole protocol of treatments for her, which was both microcurrent machines and light therapies. And since that time, Bashar's eyesight has improved tremendously, and she has a whole new life now because of it.
About 10 years ago, I was diagnosed with macular degeneration. The subsequent diagnoses that I had all confirmed that it was either wet or dry, but there was no hope. My research brought me to Dr. Kondrot's clinic, and from that, it also brought me hope that there was something we could do. And he stressed not only different therapies, which have been important, I think, in my treatment, but also the nutritional value of to condition the body to withstand this disease.
At the Healing the Eye and Wellness Center, we emphasize an all-organic diet consisting of fruits and vegetables. In fact, at the center, we grow our own vegetables in a strict organic environment.
Dr. Kondrot is the pioneer in the field. Dr. Kondrot developed the protocol that is now being implemented here. He's had remarkable success. It's incredible. As a matter of fact, when I first heard about it, I didn't know whether I even believed it or not, but I certainly do now.
At the Healing the Eye and Wellness Center, we carefully evaluate every patient for nutritional deficiencies and toxic metals. Most patients need a nutritional IV to help restore their nutritional state.
Dr. Kondrot's extensive research has taken him around the world and places him in a unique position to share this knowledge through his two best-selling books, Healing the Eye the Natural Way and Microcurrent Stimulation, Miracle Eye Cure. Both books are solid introductions into his philosophy and practice. His latest book, The 10 Essentials to Save Your Sight, has received rave reviews.
My mission is to bring hope to the thousands of patients who are losing their eyesight. Don't despair if you have been told nothing can be done to improve your vision. Change your diet. Begin to remove toxins from your body. Explore these alternative therapies that can act as a catalyst to improve your health and vision. It is my goal to improve your health and clarity of vision.
Healing the Eye and Wellness Center in Dade City, Florida has a fully functioning organic ranch with a garden, chickens, goats, cows, donkeys, and pigs. The grounds include a basketball court, swimming pool, hot tub, weight room, and infrared sauna, along with many miles of sandy road for jogging. If you like bass fishing, the ranch borders Lake Moody, one of the top bass lakes in Florida. The center houses accommodations for both you and your family during your stay. To learn more about Dr. Kondrot and the Healing the Eye Center, visit healingtheeye.com.
Yeah, special thanks to Martin Sheen for putting that production together. I hope you enjoyed that. So next slide. Next.
Next one.
All right, now my gift to you. I would like to offer you my best-selling book, 10 Essentials to Save Your Sight, free. All you have to do is just pay a nominal amount of postage and shipping. And for those of you that are overseas, we can send you an ebook, so you don't have to pay for expensive postage. So you can go to healingtheeye.com /free, and there's a link, or you can just email me at info@healingtheeye.com. Next slide. Now, in case I don't finish all this material, I am having a webinar on September the 8th, next week at noon Eastern Daylight Time. It's going to be an update on the 10 Essentials, and I'm going to go into more detail about microcurrent, light therapy, and things like that. So you can register by going to healingtheeye.com /webinar 2014. If for some reason you can't make the webinar, register anyway, and I'll send you a link to view the webinar at a later date. So I hope you can join me for that webinar. Next. And as I mentioned, if you're interested in a copy of these slides, just email me at info@healingtheeye, and I'll send you a PDF of the slides. Next. So there's a dramatic increase in eye diseases worldwide. Why is this happening? And I believe homeopathic laws can explain this increase. Next. And this is to just illustrate the problem that we're facing. Age-related eye diseases, cataracts, diabetic retinopathy, glaucoma, are expected to dramatically increase from 28 million today to 43 million by the year 2020. Next. The Archives of Ophthalmology looked at a study of over 10,000 patients, and they looked at the incidence of macular degeneration, glaucoma, and cataracts. Next. And this indeed, they're looking at a 27% increase in macular degeneration, increase in diabetic retinopathy. Next. So let's look at the eye. This is a cross-section of the eye, and unfortunately, I don't have a pointer to help illustrate some points, but you can see the front part of the eye, the lens, and this is one of the most common problems that we see when we become older, is degeneration of the lens, which results in the cataract, and I believe this is due to toxins in the environment. And also we see changes in the back of the eye, the macula. This is the most sensitive part of the retina, and aging changes, toxins in our environment, poor nutrition affect the macula. And then the optic nerve on the extreme right, which we see diseases that relate to glaucoma and toxicity also. Next slide. Let's talk a little bit about macular degeneration. There's a loss of central vision. It's usually slow, painless. Central spots called scotomas, and the symptoms are usually bilateral. Next slide. We see pigment changes, drusen, areas of chorioretinal atrophy. Next. And here we can see on the left, an example inside the eye, those little white areas are called drusen. It's a German word, Druse, meaning wart. And they look like little warts, accumulation of waste products in the eye. And on the right, you can see the wavy lines that you see with macular degeneration. Next. One way we test this is using an Amsler grid, which is like a graph paper. We have the patient look at that graph paper, and they see wavy, distorted lines. Next. This is a more serious condition where you have a hemorrhage inside the eye due to fragility of the blood vessels, sometimes because of lack of oxygen. Little tiny blood vessels grow. They're very fragile, and with trauma, injury, they spontaneously bleed. This is a case of wet macular degeneration. Next. Glaucoma is another problem, and there's been a dramatic increase in glaucoma in the United States and worldwide. Next. And in glaucoma, aqueous is produced in the eye, and normally the aqueous collects and is responsible for supplying oxygen and nutrition to the eye, but in glaucoma, the outflow becomes blocked and you have a buildup in pressure. Next. The diagnosis of glaucoma is very difficult. It's not just pressure, because there is a condition called low pressure or low tension glaucoma, where the pressure can be normal or low. Glaucoma is a disease of the optic nerve, where you have changes in the visual field and changes in the nerve. Next. One way we measure for glaucoma is a visual field test. Glaucoma is often called a thief in the night because you lose your peripheral vision out here very slowly, and many times you're not aware of it because this change occurs so slow. Next. And this is an example. This slide shows loss of visual field. You see the black areas are loss of vision. The lighter areas, the white areas, are good vision. And you can see on the bottom the damage done with glaucoma. Next. Also, we get changes in the optic nerve in the back of the eye. You can see on the right is a normal optic nerve. On the left, you see an enlarged white area, which is damage to the nerve. White means lack of blood supply or atrophy. Next, please. I'd like to talk about suppression. And I firmly believe that this model of looking at suppression as an explanation of the increase in eye disease. Conventional medical treatments, as many of you homeopaths that are listening know, cause suppression. So homeopathic principles can explain why this increase in eye disease is occurring. Next. We also have decline in nutrition. Use of preservatives, chemicals, genetically modified organisms, heavy metal poisoning, etc. are contributing to this increase. Next. A recent article reported that lead and cadmium accumulate in human ocular tissue, particularly in the retinal pigment epithelium. In addition, I feel that lead is a leading contributing factor to the development of cataract. There was a Harvard study done that showed that elevated lead in our bodies clearly is related to cataracts. Next. But big pharma, I think the pharmaceutical industry is the largest contributing cause in the increase of all eye disease because of suppression produced by modern pharmaceutical medications. Next. Let's look at antibiotics for conjunctivitis. Treatment of chronic blepharitis, which is a common inflammatory condition of the eyelids, steroid eye drops. I believe that cataract surgery, and I'll talk a little bit about that, is also suppressive. Laser surgery and injections for retinal disease. All these things are suppressive. And as homeopaths, we know that we're pushing the disease deeper into the body. We're not looking at the underlying cause. We're not treating the etiology. We're pushing the disease deeper. Next. There's an example of purulent conjunctivitis. If this patient would go to the emergency room, they're immediately prescribed antibiotics and steroids. And yes, it'll help make the eye feel better, clear up the inflammation, but it does nothing for the underlying cause of disease, and it does push the disease deeper into the body, much like treating eczema, psoriasis with steroids, pushing the disease deeper. Next slide, please. This is a sty or hordeolum, and many of you homeopaths out there that know Staphysagria is the major remedy for that. And of course, by surgical removal of this or treating it with steroids, we don't treat the underlying cause. Next, we're causing suppression. Cataract surgery, and this may come to a surprise to many of you, cataract surgery is a form of suppression because if the lens becomes opacified and the person cannot see, we have to look at the underlying cause. Just by simply removing the lens is not looking at the underlying cause, and it's going to push the disease deeper into the body. Next slide, please. Steroids are the most commonly prescribed drug to treat infection and inflammation in all eye disease. There are many side effects listed from steroids, but from the homeopathic perspective, these are not side effects, but are the result of suppression. Next, please. Increase in intraocular pressure or glaucoma can be a side effect. Cataracts, infections, herpes simplex, corneal ulcer. All these things are more serious conditions than using something safer like homeopathy. Next. Antibiotics also cause suppression, as you know. Overgrowth of non-susceptible organisms, retard corneal wound healing, punctate keratitis, increased lacrimation, etc. Next. Glaucoma eye drops are suppressive. Why? Because they don't treat the underlying problem. Yes, they'll lower the intraocular pressure and may help slow the progressive loss of vision, but they suppress the natural production of aqueous humor, which is essential for transporting oxygen and nutrients to the eye. So we need a better approach. Next. There was a study done, 3 major populations. The odds of having macular degeneration were found to be 1.7 times higher after cataract surgery than without cataract surgery. This was published in the American Journal of Ophthalmology. Now, the average ophthalmologist will say, well, macular degeneration is more common because the person's getting older. But as a homeopathic doctor, we're looking at cataract surgery causes suppression. You're not looking at the underlying cause of the cataract. Next. I like to look at the eye anatomy and also levels of pathology. You have 3 layers of the eye. You have the conjunctiva and cornea, iris and choroid, retina and optic nerve. You need to relate these 3 layers with Hering's law. The conjunctiva and cornea are kind of like the skin of the body. It's superficial. So as you go deeper into the eye, disease becomes more serious. And finally, when you get to the retina and optic nerve, that is the neurological tissue. So when you're looking at eye disease, you have to look at eye disease in terms of Hering's law, what is superficial and what is deeper. And that's one of the reasons why cataract surgery, which is a superficial condition, you have the surgery, it pushes the disease more deeper. Next slide, please. So, as all homeopaths, we're searching for the simillimum. Many cases of eye pathology are poorly represented in the materia medica. Since the eye is derived from the neuroectoderm, the skin section of the repertory has important value. So, and also symptoms associated with certain organs, such as the liver, can also be valuable in searching for a remedy because in Chinese medicine, the liver and eye are connected. So, look at the entire repertory when you're looking at eye diseases. Next slide. Emotional states are very important. And I have found that just about every eye problem that I see does have some emotional connection. So we look at the mind section under emotions, and we look at the generalities section. to try to come up with the simillimum. Next slide, please. Now, homeopathy in ophthalmology really is not new. Believe it or not, in 1879, the New York Ophthalmic Hospital was under homeopathic management. In 1931, they treated over 31,000 patients. They even offered postgraduate courses in homeopathic ophthalmology. So many ophthalmologists were homeopathic doctors. Next. There were several journals and societies that existed. As a matter of fact, the drug proving of Belladonna was published in the American Homeopathic Ophthalmology and Otological Society Journal. Next. And here are some standard works on ophthalmology by homeopaths. So these are excellent reference sources. Next, please. My favorite book is Homeopathic Therapeutics and Ophthalmology by John Moffat, which was published in 1916. Next. Another good book by A.B. Norton, Ophthalmic Diseases and Therapeutics. I'm in the process of right now is writing a more up-to-date book on homeopathy and ophthalmology, which I'm hoping it'll be a book for the general homeopathic practitioner to help them understand some basic anatomy of eye disease, how to do a basic eye evaluation, how to use ocular findings in helping them treat homeopathic patients. Next, please. There was a study done in 1891 by Dr. Norton, the homeopathic treatment of incipient senile cataracts with tabulation of over 100 cases. Now, of course, in 1891, cataract surgery was a major operation. Patients had to be in the hospital for a week. In the care, there was a high rate of infection. But looking at his results illustrate the power of homeopathy. Next slide, please. This is an example of a cataract, which is a clotting of the central lens of the eye, which occurs as we get older. I believe that's strongly related to nutrition and heavy metal poisoning. And as Samuel Hahnemann stated, we have to take care of the underlying cause of disease. So many times when I see a patient with cataract, one of the first things I do is to evaluate them for heavy metals. And invariably, many of these people will have elevated lead in their system. Next slide. In his study, he looked at 295 patients, but he studied 100 patients who were under treatment for greater than 3 months. Next. Improvement in 58% of the cases, which is remarkable. No change in 42%. This is remarkable since cataracts do not improve with time. And in many cases, stopping the progression, the 42%, is a good feature because stopping the progression could eliminate the need of surgery. So these results were very, very favorable. Next slide. These were the top 3 remedies in Norton's study: causticum, calcarea phosphorica, and sepia. These were the top remedies in his study. Next. There was also a study done looking at homeopathy in the treatment of allergies. This was done by Mark Abelson, using an ingredient of apis, euphrasia, and sabadilla, 32 patients with ocular allergies, significant reduction in signs and symptoms. I like to practice classical homeopathy. I usually don't like to look at polypharmacy and combination of ingredients, but in many cases, patients do want some symptomatic results. So, the combination remedies can be helpful, but the best way to treat any eye disease is the classical approach. Next slide. These are some publications and presentations that I have had. One was the homeopathy in the treatment of macular degeneration, which was published in the New England Journal of Homeopathy. Homeopathy in the treatment of chronic eye disease was presented at the American College of Alternative Medicine. Next slide. I'd like to go over some cases that illustrate the power of homeopathy. Next. This was a 57-year-old radiologist a medical doctor presented with a history of sudden onset of blindness in his left eye. Totally blind, midnight in a coal mine. He is very, very loquacious with pressured speech. He gets mad very easily. He can't stand rudeness. He also has the peculiar symptom that the vision is better in a dark room than worse in a light. It's interesting in his history that he told me that he loves to argue. He loves to get into an argument. And even if he knows he's wrong, he'll just continue to argue and wear the other person down until they admit he's right. Next slide. He also has a 5-year history of insulin-dependent diabetes. Next. Vision was 20/40 in the right eye, which is close to normal, and bare light perception. He was almost totally blind except being able to barely see light. Next slide. And this is what the back of his eye looked like. It was very white, which is classic for an arterial occlusion. And we were taught in medical school and my ophthalmology training that once this event develops, there is no cure, there is no reversing this condition. Next. I prescribed Bothrops 12C twice a day, and he had a complete return of his vision in 3 days, and he's doing well 2 years later. Next slide. And George Vitholkis states that this remedy, together with lachesis, arnica, lactrodectus mactans, and lycopodium, should be our main remedies for coping with the first hours following heart infarcts and brain thrombosis. Amaurosis is a strong symptom. Day blindness, can scarcely see her way after sunrise. And this was a infarct of the artery of his eye, and he had the peculiar finding of the day blindness. Next. Another case, a 78-year-old female with macular degeneration, cataracts, and a balance problem. Next. Vision is very dim, and she has trouble reading and dancing. She also has vertigo and ringing in her ears. She is so weak that her arms and legs shake. An important aspect of her life was ballroom dancing, and her sexual drive was never very high. Next. Physical exam showed a marked decrease in vision in both eyes. She has cataracts and myopic degeneration. Next. According to A.B. Norton, in his article, The Homeopathic Treatment of Incipient Senile Cataracts, sepia is the #1 remedy to think of in females with advanced cataracts. So she was given sepia LM1. Next. In 8 months follow-up, she can read the menu. She has a 70% improvement of her vision. Street signs are becoming clear. Her colors are more vivid. No more dizziness. And she's confident walking, and she's back to her ballroom dancing. So homeopathy is wonderful. It should be considered in every patient that has an eye problem. And even if you're not an ophthalmologist, just use the classical approach to evaluating a patient, picking your modalities and key symptoms to try to come up with the best remedy for that particular situation. Next. So these are the top 12 homeopathic remedies that I have found. I reviewed all of my charts over the last 10 years, and these are the top 12 remedies. And what I'd like to do is just briefly go through each remedy. Next. So arnica is the #1 remedy for trauma, as we know. It's a good remedy for subconjunctival hemorrhage, which is bleeding on the white part of the eye. It's also a good remedy for retinal hemorrhage, or hemorrhage inside the eye, especially with trauma, and inflammation and pain aggravated heat. So when a patient states that warm compresses make them worse, then you have to consider arnica. Or, of course, the classic mental symptom with arnica, they have a sudden loss of vision, but they deny anything's wrong with them. Everything's all right. The classic denial of arnica after an injury. Next, please. There's an example of a subconjunctival hemorrhage, the redness around the eye. Next. Aconite, conjunctivitis from cold, dry wind, reflection of snow, post-excimer laser inflammation. The excimer laser is a laser that uses ultraviolet light. And I've used aconite very successfully after complications after the excimer laser surgery, LASIK procedures or these refractive procedures that are going on. Inflammation from injury in addition to symphytum, hot and dry, red conjunctiva of the lids, profuse watering, and of course with aconite, loss of vision after fright, very cold or hot weather. And just last week, I saw a lady that came in with loss of vision in one eye, and the key presentation that she was outdoors at a picnic and sustained exposure to cold. She developed a really cold neck on the left side and stiffness and loss of vision in her left eye. And I thought that was really peculiar. She had a lot of the fears and anxieties that aconite has, and aconite was prescribed very successfully in treating her eye condition. Next slide, please. Belladonna is a big remedy. Sudden onset of inflammation, pupils dilated and sluggish. It's a big remedy used for elevation of intraocular pressure in glaucoma, retinal congestion, optic neuritis, and neuritis. Think of inflammation, sudden onset of inflammation. Think of belladonna. Next. Here's an example of an angry-looking eye with a lot of hemorrhage and swelling that occurred suddenly, a classic belladonna presentation. Next. And here's that wild-looking eyes with belladonna. Next. Euphrasia is a very important remedy, eye bright, especially for corneal problems, inflammation, burning and swelling, foreign body sensation in the eye. And when in doubt, I like to use euphrasia. Often I'll use euphrasia tea. I'll have the patient make a cup of euphrasia tea and use that for a compress on the eye, which is very helpful. Thick acrid discharge, similar to mercury, or mercury is thin, and photophobia. Next slide. Mercurius, every cold settles in the eye. The upper lid is thick and red. They have a lot of vascular problems. By vascular keratitis, keratoiritis, you'll see blood vessels growing in the eye. Destructive, it's a destructive remedy where there's a lot of damage to the eye, like all of the syphilitic remedies. Destruction. Next, please. And here's an example of that keratitis. You have inflammation, you see a lot of tiny blood vessels around the eye. It's a remedy that produces a lot of destruction. Next. Phosphorus is a big remedy for glaucoma. I always think of phosphorus when the patient presents with visual symptoms, lights and hallucinations. Objects look red. So the visual hallucinations, the presentations of colors or floaters, visual symptoms. Hyperemia of the retina, swelling of the retina, choroid, optic nerve, atrophy and paralysis of the optic nerve. It's a big remedy when you see damage of the optic nerve. Also in diabetic retinopathy, because phosphorus is a big remedy for diabetes with the increase in thirst. Next, please. Pulsatilla, conjunctivitis, allergies, burning, itching, rubbing, pain, itching, ameliorated cold applications like sulphur, obstruction of the lacrimal duct, characteristic yellow-green discharge, and it's a big remedy for styes, along with Staphysagria. Next, please. Rust toxidendron, lids inflamed, elucidated, and swollen. Upon opening the lids, tears or pus gush out. So there's this tightness of the eyelids, you know, the hinge, the stiff hinge with rust tox. So they have a difficult time opening up their eyes in the morning, but as they move their eyes, it becomes a little bit more flexible. Rust tox is a big remedy for iritis, rheumatic conditions, ulceration of the cornea, orbital cellulitis, panophthalmitis. In Norton's book, it was the #1 remedy for treating infection after cataract surgery. He presented a case of an eye filled with pus and completely cured with rust toxagentin. So think of this remedy for suppurative conditions of the eye where there's a lot of yellow pus and discharge. Next, please. And here's an example of the white pus and discharge of a severe eye infection. Next. Ruta is a really big remedy from straining the eyes, along with physostigma, natmur, and anosmodium, especially from fine work. Stiffness of the eye muscles. We know that Ruta is a remedy for tendons and stiffness. So it's the #1 remedy that I use when patients complain of eye strain, tightness of the eyes, fatigue, and disturbances of accommodation. By that I mean disturbances of focusing their eyes. They have a difficulty in focusing. So Ruta should be the #1 remedy for eye strain. Silica, inflammation and obstruction of the lacrimal ducts. Also for styes, it's the #1 remedy to think of in an infant that has a blocked nasolacrimal duct. They're very sensitive to cold, especially the head. Big remedy for ulcers and abscesses of the cornea. And as we know, they have a tendency for their wounds to heal very slowly. So often this is a remedy I think of after any surgical procedure if the eye is healing slowly. Think of silica. Next, please. Symphytum is the arnica of the eye, a remedy to think of injuries to the eye, desire to rub the eye. And if you look at the materia medica and repertory, it's very difficult to distinguish between symphytum and arnica when it comes to using it as a first-line treatment after injury. But it seems like when there's a cataract after injury to the eye, this is a little bit more specific for symphytum. But symphytum is a big remedy for injuries to the eye. Next. And this is an example of an injury on the right eye, on your left, injury to the eye. You can think of either symphytum or arnica to treat this. But if there's any evidence of a cataract developing, which is a very common finding after injury, then I would be inclined more to use symphytum than arnica. Next. Staphysagria is a big remedy for styes, photophobia, iritis, and of course Staphysagria is a classic remedy for indignation, ailments from indignation. And many times I'll see patients with a stye illustrated with that slide, and there is a history of indignation. Also, it's a remedy to think of problems after an incision. So there are many surgical procedures where an incision is made to the eye, and if there is complications or poor healing, the differential would be Staphysagria or possibly silica. But if there's more of an emotional component involved, then I would go with the Staphysagria over silica. Next slide, please. Sulphur, a big remedy for conjunctivitis, ameliorated cold applications, just like Pulsatilla. Probably the #1 remedy for chronic blepharitis, which is a common eye problem where the margins of the eye are red. You have iritis. There's a purulent discharge and disturbances of vision before headache. Next. So the takeaway from this talk is that the increased incidence of eye disease is related to suppression. So we need to understand this. When you're taking a patient's history, look at how they've been treated in the past. The use of steroids, antibiotics, and surgical procedures. Look at Hering's law when treating eye disease. Where is the disease in relationship to the level of the eye? Is it superficial, in the middle, or deep? Remember, the eyes derive from the neuroectoderm, so the skin section of the repertory can be very helpful. Homeopathy is very valuable in the treatment of eye disease, and I hope that all of you will be inspired to look at your patients with eye diseases and to embrace homeopathy as probably the #1 treatment. Next slide. Next. So remember now, my gift to you, email me and we'll send you the book. Next. I'd like to talk a little bit, we have some time, about some other things. Dr. William Bates was a turn-of-the-century ophthalmologist who believed that palming could be very beneficial. I love palming because palming is kind of a meditation to the eye. And Bates felt that all eye disease was caused by emotional problems to the eye. So by palming, you're directing the healing energy from your hands into your eyes. And at the same time, you're closing your eyes, you're relaxing your eye muscles. So it's a good meditative procedure. Have some positive affirmations, visualizations to help improve the circulation and healing. Next. Bates also talked about sunning. And of course, when I did my training in ophthalmology, we made fun of Dr. Bates. And especially with sunning, how could this possibly help your eyes? Next. But there are some research articles coming out that Bates was right. There's studies done using red and infrared light in the treatment of eye disease, and it shows that it has a regenerative effect. When the sun is on the horizon, when the sun is setting or rising, it's producing a red near infrared light. So there are some studies to say that Bates was right. Sunning can be beneficial. And I recommend if you are interested in sunning, maybe 10 to 15 minutes in the morning or the evening when the sun is on the horizon. You should do this with closed eyes. Do not open your eyes because an excessive amount of light can be harmful to the retina. Gently look at the setting sun or rising sun, turn your head back and forth and let the image of the sun go across the eye. Next. There is a laser that produces this infrared light, and this is the delta laser, and there's some pictures of treatment. Not only do we treat the eye, but we also treat the neck, and we also treat the long bones of the body, or sternum. So the laser light improves oxygenation and circulation. There was a study done that showed that this laser light will improve retinal circulation when you apply it to your neck and also over your eye, and it also stimulates stem cells. Next. So this is a device that I recommend. It's called the Delta Laser. It has 4 modalities in one. It produces a magnetic field, a red infrared light, a syntonic light, and ultrasound. So this is what I recommend to improve your eye health. Next. Microcurrent is something I also use in my practice. I first became interested in microcurrent when I heard about Sam Snead, a famous golfer, having a dramatic improvement of his vision. And I treated Sam Snead for a week, and he gave me golf lessons for a week. But Sam told me, he put his arm around me, he says, Dr. Kondrot, the only hope I have for you, the only advice I have for you is cut back for a year and just give up golf, which I did. I finally gave up golf. Next slide. Debbie, I'm glad you liked my
10 minutes a day of golf. You'll slowly over the next 30 years, you'll be good.
Right. So mechanisms of microcurrent. Now, microcurrent is a lot like homeopathy. Why? Because we deal with frequencies or vibration. In microcurrent, we try to match the frequency of the current to the frequency of the disease in tissue. Microcurrent improves blood flow, stimulates cellular activity, removes scar tissue, reduces inflammation, has a neuroprotective effect. So it's really a wonderful treatment to help not only the eye, but help other physical problems. My true love is classical homeopathy, but those of you that do homeopathy know that homeopathy can be very difficult. It takes time to find the right remedy. But when you do find the right remedy, it's very joyous because you truly see miracles happen. So in my practice, I use a combination of light therapy, microcurrent, and classical homeopathy. I do feel that all of these are synergistic. They work together. But the true goal is to find the simillimum, the right simillimum to truly heal the person. Next slide. Microcurrent is used by many athletes. On the left is Lance Armstrong. So in addition to drug doping, blood doping, he used microcurrent, his team. And then the other two athletes on the right, myself and my wife, we did the Marine Corps Marathon. We were beat up, but 30 minutes of microcurrent, all my aches and pains went away. Next slide. As I mentioned, there's a particular frequency with microcurrent, and we try to match the frequency, much like we do in homeopathy. Next. And this is how we apply it to the eye. Next slide. We're having a conference. If you want to learn more about microcurrent, it's going to be held at the beautiful Dolphin Beach Resort in St. Pete Beach, Florida. October the 1st through the 5th. We have presenters from all over the world talking about microcurrent. So email me at info@healingtheeye.com, and I'll send you information on the microcurrent conference. You can also use that same email address if you want a copy of the slides. Next. Next slide. And don't forget, my gift to you, you can go to www.healingtheeye.com/free, and you can sign up for your book or just email me. All I ask you to do is just pay a nominal amount for postage and shipping. Next. And my webinar is going to be September the 8th at noon, and you can sign up by going to www.healingtheeye.com, webinar 2014, or just email me for more information. So, Debbie, I promised you I'd finish all 104 slides.
You really did it. I'm in shock. I mean, no, you went through.
I can loosen up my
Yes,
seat.
definitely. I think this is the first time on the Healt-Inn show we covered the 105 slides in 1 hour, and it is really exact timings.
Yes,
well, I think our mind is anytime somebody spends a long time on one slide, people tend to fall asleep.
Well, you really plowed through it, and one of the tricks to making a really fantastic slide presentation is to put a small amount of information on each slide and then just click through them. And you did that really well, and everybody is probably sitting in their seats right now in awe. This is one of the comments in the chat from Michelle was, just when you thought the program couldn't get any better, it did.
Oh, thank you.
So you're like a top show, and we would like to have you back giving some more case studies. I think it's really fascinating, especially the ability to help so many people with simply 12 remedies. I think that's very impressive, and to use classical homeopathy and not combination remedies. If you're able to and have the time, we would love to have you back.
Oh, I'd love to be back and present more cases or my approach.
Absolutely, and the totality. Manfred, I think it's Manfred Mueller here in North Carolina, sleep was never an option. So I guess sleep is absolutely essential.
Right.
And so is everything about your approach, which you have talked about in the Healing the Eye the Natural Way, in your book and your other books about holistic approach, that nutrition, diet, breathing, exercise, the importance of circulation, and it seems like I felt an emphasis on the area of suppression in treatment of the eye and the whole body today. One of the things that I always learned in my studies was that the ophthalmologist could see the window in the eye, that they could see what health conditions they had just by looking at the retina. Is this a fact that you believe is true?
Oh, definitely. In fact, when I look inside the eye, I can tell if you have a good diet or not. There's part of the eye called the macula lutea. And lutea, it means yellow. And if that is yellow and bright, then I know that you have a good, healthy vegetarian diet. If it's dull and there's no yellow luminance to it, that means that you probably aren't eating many vegetables, and, you know, poor health is on its way.
Eat your greens. Do your juices.
Definitely, definitely.
Okay. I think there's one more slide, and that is the upcoming calendar. September 29th, Ambiko Waters is going to return talking about homeopathic color and sound remedies and how they work the chakras. October 13th, Mike Andrews is going to introduce his new book on autism. December 1st is Dr. Carlos Goncalves, MD, and I'm not sure exactly what the program is, but it's going to be great. And you can see there are a lot of absent weeks on our regular Monday show. I'm going to be taking some time off, and if anybody has suggestions for future interviews, people who you would like to see as a guest, let us know. I thank you for many healing prayers from everyone. All of the show archives are available here at nissancommunications.com under the archives section. Also, the background information about each of our guests over the past 3 years is available on Homeopathy World Community. Please join us on Facebook.com, Homeopathy World Community. And Alan Phillips, who was doing shows on Blog Talk Radio about vaccinations and your rights, I think he has switched to another day and time on Blog Talk Radio. So I will get that information out to you when I learn more about it. So just have a beautiful, clear vision of your future in health. And thank you again to Amnon, Dr. Sharma, and Dr. Ed. We thank you all for being with us. We had over 20-something people in the chat today. Please share the shows, and blessings, lots of love to everyone. Bye-bye.
Okay, thanks,
Bye-bye.
everyone.
Thank you, Dr. Edward. Thank you, Debbie.
You are tuned to the Nissan Communications Network. Our weekly lineup of call-in programs includes Computers 2K Now with Amnon Nissan, Healt-Inn with Debbie Bruck, Breaking Free with Marilyn Shannon, Lessons of Vietnam with NCVVI members, The Tanya Love Show, and if you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it at www.nissancommunications.com. Sponsored by Atomus.com, makers of quality video recorders and converters for professionals. That VidBlasterGuy.com, CarolinaApparel.com, and DeltaForce.net.